trying to reduce the inflammation, because that then also goes on to reduce the damage, that kidney stones, and all those sorts of things. So what you do want to get tested and what can.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin and co-creator of the Kidney Disease Solution, as well as being part owner in Genesis, which is our supplement range that goes along with that. And I'm joined today by the amazing, wonderful Emily Cahill. Emily is a fully qualified registered nurse. She works at a large cardiovascular unit here in Melbourne, Australia. So let's just get straight into it, Emily. What is sarcoidosis?
So sarcoidosis is it's, I guess, classified as an inflammatory disorder, and it can affect different organs and different tissues in the body. And what happens is they don't really understand exactly what the cause is, but they think it's to do with the body's immune response to some sort of unknown substance. There are potentially some links to some bacteria, viruses, chemicals and things like that, but the immune system it starts to respond to whatever it is, and as the immune system does when it's trying to heal something, it causes a lot of inflammation and the release of different inflammatory molecules and immune cells and cytokines and things like that. Usually what happens, and what's supposed to happen, is that after the threat has been neutralized, or the substance is no longer present, then our immune system calms down and that inflammation all resolves and all stops. In sarcoidosis, for some reason, this inflammatory response doesn't switch off. And so what we end up getting is immune cells that start to clump together. So they start to group together and develop into these things called granulomas. So granulomas are small clumps of immune cells that can actually form anywhere in the body. There are some sites that it's more common to develop these granulomas. So the lungs is probably the most common, and then the skin is another area that's up there as well. But they can develop in any organ, so you can get them developing in the kidneys. They can develop in the heart. So yeah, basically lymph nodes, and the eyes is one of the other more common affected organs of these granulomas.
Okay, so what else do we want to say about sarcoidosis? It's obviously treatable and successfully generally.
Yes, yeah. A large, I guess, proportion of patients go into remission, somewhere between sort of 2 and 5 years. So it is something that can go into remission, and they tend to find that, obviously, there's always the risk with anything that it can reoccur, but it doesn't seem to be a condition that has a high risk of recurrence. So you may have had one presentation of sarcoidosis, gone into remission. It doesn't necessarily mean that it's going to happen again.
And so what do we do to treat it?
Yeah, so from a medical point of view, so if people are being treated medically, they often use steroids. And so what they're trying to do is trying to reduce the inflammation, because that then also goes on to reduce the damage that can occur in the structures wherever the granulomas are. So that's one of the common medical treatments. And then for people who steroids don't work, then they look at immunosuppressing medications. So I guess when we're looking at it from a natural medicine point of view, we're trying to do the same thing. So we want to work on reducing inflammation, and we want to work on that immune modulation as well. They're probably the two of the key. Yes, I know. Surprise, surprise. Yeah, so they're I guess two of the key things. And then when we're looking at people, particularly with a kidney manifestation, so it's reducing the risk of kidney stones. The other thing that can happen is where the kidneys can become calcified in areas because of their elevated calcium. So we're wanting to reduce the risk of kidney stones, calcification and inflammation in the kidneys as well.
Thanks again, Emily. I really appreciate it. If you've liked this content, make sure you give us a like. And if you hit subscribe, you'll get notified anytime we put up new content. If you want to know more about who we are and what we do, you can head over to www.kidneycoach.com and you'll find everything you need to know about us on that website, including supplements that we sell and our program, the Kidney Disease Solution. Emily, thank you again for all your valuable information and knowledge. I always appreciate it. And we'll all see you next time. Bye.